wake up, I see you as you leave. I feel it, I see it as you leave. When we kiss, I went deep, but you're far away. Be bandit.
Is happening from health, education, and what have you. I am Lilian Udodi.
And I'm Faith Oloruntoba. You're welcome to the show.
So we're going to be talking about the dreaded Ebola virus. According to the World Health Organization, the Ebola virus is the most violent disease. Right, Faith?
Yeah. That adjective you use, dreaded, is indeed apt because Ebola virus is the latest health scare in West Africa. According to World Health Statistics, over 400 people have lost their lives. Actually, Ebola virus is not new to us because it actually had its first outbreak in 1976 in the Democratic Republic of Congo and Sudan.
Okay.
But early this year, it was reported in Guinea, Sierra Leone, and Liberia. And it's really alarming.
That's really close to
Because we are
home.
neighbors.
Yeah.
Yes. So it's really a source of concern. And just yesterday, the health commissioner for Lagos State,
Okay.
Mr. Jide Idris,
Okay.
has said that Lagos State is taking measures to ensure that Ebola virus does not enter into Lagos. Imagine if it does.
That's so scary. That's really scary. Okay, so we have a guest on today's show, a doctor who will be educating us. He is Wing Commander Johnson Udodi, a doctor with the Nigerian Air Force, a general practitioner, and he is currently the commanding officer of the Nigerian Air Force Medical Center, Mobility Command, Yenagoa. Welcome, sir.
You're welcome,
Thank you.
sir.
Thank you very much.
So, what is the Ebola virus disease?
Yeah, thank you. Ebola virus disease, also known as hemorrhagic fever, is the disease condition that arises from infection. When a person is infected with the Ebola virus, then there are a number of disease conditions that arise as a result of that infection. That is what is referred to as Ebola virus disease.
Thank you, sir.
Wow.
Yeah.
Okay.
So how does Ebola virus disease spread?
Okay, let me start by talking about how a human being even gets infected in the first place, because Ebola virus is not primarily a human infection. It is believed that the reservoir for that virus is there are wild animals. The fruit bat especially has been identified as the reservoir for it, and through that it gets to spread to other wild animals such as monkeys, gorillas, wild pigs, and so on. So human beings get to contact the disease through inadvertent contact with infected animals.
Okay.
So you see, you have a condition, you have a situation where people who live in forested areas within which the virus can be transmitted from one person, from an infected person to someone else. You have a situation where from the time that the virus is within the blood stream or within the body of an infected person, he becomes infected. From the time it can be isolated from the blood, that person becomes infected, and he does not cease to be infective even if he dies. So you have a situation where his corpse can still infect people who come in contact with it. So that makes it particularly dangerous because the relatives of the victims of this disease, in an attempt to properly dispose of the bodies by burial or some other forms of interment, come in contact with the bodies of these victims and they inadvertently become infected in that process.
So what are the signs and symptoms of the Ebola virus disease?
Yes. That's another thing that is very important because the signs and symptoms can often mimic those of common diseases in our environment. Diseases such as malaria, typhoid, meningitis, diseases that are invariably treatable. So you have a situation where a person may present with fever, body pains, joint pains, headache, and eventually may begin to present with diarrhea, vomiting, and all this comes before you can even begin to get what might be referred to as the more scary symptoms of bleeding, bleeding through the orifices of the body, the nose, the mouth, the anus. So, but if you look at those symptoms that we talked about earlier on of fever, headache, joint pains, these are even the diarrhea and vomiting, things that you normally will associate with diseases such as malaria, such as cholera, such as typhoid. So a lot of times infected people, the diagnosis is not made early because they are misdiagnosed as these other lesser, or what you might think as lesser diseases, and so that presents a problem. So those are some of the symptoms.
Okay, so how can it be prevented?
Yeah. Prevention of the disease, unlike many other diseases that have vaccines, that once you administer the vaccine to a person, you offer some degree of protection to the person, there is as yet no vaccine against Ebola virus disease. So prevention basically is by knowing the routes of transmission, how they get transmitted from the animals into human beings in the first place, then from one human being to another, and then preventing those, taking measures to prevent that transmission. So avoiding contact with wild animals as much as possible is one way of preventing it. You have people going into bushes, hunting wild animals, and some go as far as eating parts of those wild animals raw.
All you bushmeat lovers.
They are actually exposing themselves to such problems. Then from person to person, it is of course more common among those who are relatives of people who are infected, who are caring for those that are infected, among health workers also who are caring for infected persons that are on admission. Basically, in those people, what you have to do is take extra precautions to wear personal protective equipment. We're talking about things like gloves to make sure that you don't make direct contact with the fluids, the body fluids of infected persons. I have seen pictures, I have seen videos of people caring for the victims in the places you just talked about here in West Africa, going as far as wearing full suits that make sure that no direct contact is made between the infected person and the healthcare worker. For the general public, what we just advise is, just like you said, like the advice from the commissioner, you report any suspicious conditions, and healthcare workers should take care to make sure that when they're providing care for either suspected or confirmed cases of Ebola virus, or those caring for relatives infected or suspected cases of Ebola virus disease, we advise that they, as much as possible, wear personal protective equipment as well. And in cases where people have died from that condition, or similar conditions suspected to be Ebola virus disease, care should be taken to properly bury the remains of such people, to make sure that there is no contact, inadvertent contact with the body fluids of such persons. The good thing is there has never been an outbreak in Nigeria, and with all hands being on deck to make sure that it does not get to our own environment, we want to believe that that will be successful.
Thank you very much, sir. Okay, sir. While you were talking, you said that fruit bats and other wild animals are carriers of this virus. So is it safe to assume, for instance, in Nigeria, that those in the rural areas who live among these animals are more at risk than those in the urban areas? And
well, that theoretically that may seem correct. Those in rural areas and the fringes, like I said, of the rainforests or living within the rainforest, forested areas, obviously stand a higher chance of making contact with these animals. It might also interest you to note that most of the places where these outbreaks, where confirmed outbreaks have occurred, have mostly been in rural areas with limited accessibility, and that probably also accounts for why the spread has tended to be limited. Because if these places were cosmopolitan areas like where we are, then we expect that the casualty rates are probably going to be a lot higher. So I guess empirically speaking, you can say that those in these rural areas may be more at risk, but don't also forget that there's sometimes trading in wild animals as pets. So it is possible that an infected pet may also find its way into an urban area and inadvertently spread the disease. So we can't categorically say that any particular area is more at risk or less at risk. But these are the factors.
Okay. So, now that we are guided and educated, what do you think? We would like to know. Please log on to our website www.mediaextraordinaire828.com and leave your comments, suggestions, and recommendations. So, you now know if you have fever, vomiting, diarrhea, sore throat, joints, ache, muscle ache, stomach ache, measles-like rashes, hiccups, bleeding from body openings such as your nose, your anus, your mouth, etc. What do? Go to the hospital as soon as possible and limit the personal contact, right? The person-to-person contact. So that brings us to the end of today's program, and I want to say a big thank you to Dr. Johnson Udodi. Thank you for coming and thank you for educating us and making this interview a success.
Thank you very much.
Thank you.
You're most welcome.
Any last words?
I've actually learned a lot,
We
and
have.
I know you have as well. So take steps to ensure that you don't get Ebola virus, and if you notice any symptom that is suspicious, report to the doctor.
Definitely. So I want to say a big thank you to our crew, Jamiu, Damilare, Mercy, and Dr. Amobi. And of course, thank
Lilian.
you, Faith. Till we come
Thank
your
you
way
as well.
next week with another episode. Stay tuned. Goodbye.
I wake up, I see you as you leave. I feel it, I see it as you leave. When we're kids,